Today we are going to talk about post-50s gynecological problem. 50-year is a watershed in the life of a woman. And is it so because at around the age of 50, a very important thing happens in the woman's life, and that is called menopause. And menopause, as we all know, is defined as the permanent stoppage of menses because of the lack of ovarian activity. So in fact what happens is that around that age the ovaries stop functioning, producing hormones, and the cyclical flow which the woman was used to be having since the age of around 9 or 10 years stops. And because of this stoppage of cyclical hormonal flow in the body, certain symptoms occur which could be defined as physical problems, some emotional problems, maybe going over to some social and behavioral problems. And this whole thing taken together is called menopausal syndrome. And this is something which occurs in almost every woman. And some women can cope with that naturally, thinking that this is a part of the life and we have to live with it, while some others are dreaded to see that there is a change. They're going into old age, they're going to have lack and luster of the skin, they're going to lose the youth, they're going to lose the hair, the skin wrinkles and all sorts of things, maybe lot of sexual activity. So all these things come into in the emotional psyche. And there could be spilling over into social problems, like the woman can become withdrawn, doesn't want to like partying like before, or to mix in social groups, and so on and so forth. So this is the time when the woman actually needs help. Sometimes, I'm not saying that all women will need help, but this is a very vulnerable stage in a woman's life, and we men have to be very sensitive, and the family people, especially the husband, the grown-up children, they have to be more sensitive to the woman's need, because at that time of the age, the children are all grown up. They are moving out, either getting married or going to go for service elsewhere. The daughter is getting married, and she, for herself, what does she see? She sees a family, a nest, which she has built up in so cozily over the last during her married life, is suddenly becoming empty gradually. And she is having to live alone with her husband, and all the children have gone. So this is called the empty nest syndrome, and this is something which is very dreadful for some women. Some can adjust, but it is dreadful. So for that, if we talk about physical problems, there are problems of backache, rigidity, joint pains, etc., etc., and these are mainly because of osteoporosis. Osteoporosis happens because gradually there is a calcium and vitamin D which gets washed away from the bones because of lack of the estrogen hormone which happens in menopause. So we have to supplement with calcium and vitamin D. And we say a little bit about lifestyle modification to give the positive feedback in the woman, because if suppose there is a lifestyle modification at the pit and the woman starts walking, morning walk or even evening walk, and a little bit of exercise, cutting down on caffeine, coffee, alcohol, tea, etc., and gets to a regular life cycle, not to stay awake at night doing these days WhatsApp and things like that. So these are the things which are helpful for the woman to cope up with the positive, because what happens is if there is a lifestyle modification, there are certain hormones in the body which gets secreted which are called endorphins, and endorphins are very important to keep the positive well-being of the woman. Now apart from these physical things, there are certain other things, like for example, you have to go for some medications. If the patient is having, or patient I shouldn't say woman, is having hot flushes or night sweats or sleeplessness or insomnia, which means she's not able to fall asleep, or she's unable to maintain sleep, or she wakes up early in the morning, then we can give her something which is called an HRT, or a hormone replacement therapy. Now, hormone replacement therapy is something which has to be given under the supervision of a doctor, and a woman should not take HRT off the shelf by some advertisement or whatever, because there are certain things which needs to be checked in the woman's body before an HRT can be prescribed, which means a regular physical examination, the breast examination, if required a mammography, or some cervical smear and ultrasonography, and at least a general physical examination is important. and blood pressure and sugar. So having seen all this, HRT may be prescribed, and if the HRT is prescribed, she needs to come for follow-up at every regular interval, maybe initially at a month later or 3 months later, then 6 months later. They can carry on with the HRT for at around 5 years or so. Recent literature has shown that if low dose HRT is given, individualizing the patient and in the proper dosage and a proper follow-up, there is no increased side effect. So having said that, if we see the menopausal woman suffering from menopausal syndrome, we have to tackle her life in different ways, which encompasses not only medical therapy, it also has behavioral therapy, social therapy, group discussions, and last but not the least, hormone replacement therapy. Thank you.